Cervical cancer is one of the most preventable cancers there is, and yet attendance at cervical screenings is failing, especially in younger women. As a midwife, that worries me a lot, so today I want to do something about it. I want to talk you through exactly what a pap smear is, what happens during it, how to make it more comfortable, and what your results actually mean. No judgment, no scaremongering, just honest information. First, let's clear something up. A cervical screening or pap smear is not a test for cervical cancer. I want to say that again because it's important. It is not a cancer test. It is a preventative test. It's looking for abnormal cells on the cervix before they have a chance to develop into cancer. This is what makes it so powerful. We're catching things early, sometimes years early. In many countries, the test also now screens for HPV, human papillomavirus. HPV is an extremely common virus. Most sexually active people will have it at some point in their lives. Most of the time, your immune system clears it on its own. But certain high-risk strains of HPV, if they persist, can cause cell changes that over time may lead to cervical cancer. Catching HPV early means we can monitor you much more closely, and that's a good thing. In most countries, cervical screening is offered from around age 25, and the frequency varies depending on your results and your age. Typically, it's every 3 to 5 years if your results are normal. I recommend that every person who is sexually active, regardless of age, starts getting their PAPs done. You should have screening even if you've had HPV vaccine. The vaccine doesn't protect you against all strains. You should have had it even if you've only had one sexual partner or haven't been sexually active for years. And if you've been through menopause, you still need screening until you reach the upper age threshold. If you're unsure whether you're due, call your midwife or your primary care doctor or check your health records. Please don't guess. Okay. This is the bit most people want to know, and I'm going to be really specific because I think a lot of anxiety around pap tests comes from not knowing what to expect. The appointment usually takes about 10 minutes in total. The test itself is much quicker than that. You'll be asked to undress from the waist down and lie on an examination table. Your provider will gently insert a small instrument called a speculum. This holds the walls of the vagina open so the cervix can be seen. Then, a small, soft brush is used to collect a sample of cells from the surface of the cervix. That sample goes to the lab. That's it. It's done. The whole thing takes less than 5 minutes once you're on the table. I want to share some specific things you can do to make this experience easier because a lot of women don't know that they have options, and they do. Now, does it hurt? Honestly, for many women, it's uncomfortable rather than painful. Some women do find it painful, and that's valid and real, and it can be especially uncomfortable, especially if the cervix is difficult to find. If you have conditions like vaginismus, endometriosis, or if you've experienced trauma, you are allowed and should tell the person you're doing it about these things so they know ahead of time. And you are also allowed to tell the person doing it to stop at any time. You are always in control. I want to share some specific things that really help people during the exam. 1, ask for the smallest speculum. Speculums come in different sizes, and smaller is often more comfortable. You don't have to wait to be offered it. You can ask for it up front. 2, try to schedule when your period has just ended. Your cervix is slightly lower and more accessible at this point in your cycle. 3, warm up the speculum. Some clinics do this routinely. If yours doesn't, you can ask. If the speculums are plastic, there's no need for them to be warmed up. But a cold metal speculum can make the muscles contract, which can make the test harder. 4, focus on your breathing. Slow, deep breaths keep your pelvic floor relaxed. I tell women, breathe in slowly through your nose, out through your mouth. Don't hold your breath. 5, tell your provider if you're nervous or if you've had a difficult experience before. We really love to know these things. Good practitioners will adjust how they work with you. You don't have to just white knuckle through it. And 6, you can bring someone with you. A friend, a partner, you can always hold someone's hand. You don't have to do it alone. Your results usually come back within a few weeks. Sometimes by letter, sometimes you access them through the portal, sometimes by email. A normal result means no HPV found, or HPV found but no cell changes. This means you just come back at your regular interval, 3 to 5 years. You don't have to do anything. If HPV is found with some cell changes, you'll likely be referred for a colposcopy, a closer look at the cervix. This sounds scary, but it's a routine, low-risk procedure. It doesn't mean you have cancer. It means we need to keep a closer eye on you, and that's just good care. I'll be honest with you. I care about this topic a lot because in my practice, I've seen what happens when cervical cancer is caught late, and I've seen the difference that screening makes. I really encourage you to book your appointment and get your pap done if you are overdue. And if you have any questions, feel free to call the place and ask them all your questions up front. And if you've had a really positive pap smear experience, share it in the comments because I love hearing these experiences from you guys. Take care of yourselves, and I'll see you next time.